All right, now when our bones become soft and weak as we age, even simple things can mean long-term damage.
Yeah, last week Tiff and I got the chance to speak with a specialist about osteoporosis.
Well, May is Osteoporosis Month, and one of the main risk factors is simply being a woman.
And here now with more on this disease is Dr. Rani Chovatiya with Spine Pain Diagnostics Associates. Great to see you.
Great seeing you again, too.
Thanks for being here.
Of course.
So today we're talking about osteoporosis as it relates to pain. But before we get into that, I'd like you to just talk a little bit about your specialty, because you're an interventional pain specialist, right?
Yes, absolutely. So just to kind of explain what that really means, I did a specialized training and residency in anesthesiology, and then I also did an additional fellowship training in interventional pain, where we learned different types of techniques, different types of procedures to manage different pain conditions related to the spine, related to the joints, in addition to incorporating other therapies, including medications, physical therapy, etc. So kind of using a multimodal approach when it comes to treating these conditions.
And a lot of it is chronic pain, right?
Absolutely. That's probably what we see more commonly, especially in the outpatient setting, and so a lot of different things we can do in terms of managing that.
It's wonderful. This month is Osteoporosis Awareness Month, so that's kind of the focus today of pain as it relates to that. What is osteoporosis?
So osteoporosis is a condition where the bones can, over time, bones can develop, become weaker, can become kind of soft essentially, and at increased risk of even fracturing as a result. There are different conditions that are associated with osteoporosis or that can lead to osteoporosis. One, as you did mention before, being a woman, especially postmenopausal women are at high risk of developing osteoporosis. Smokers, people with diabetes, arthritis, cancer, a lot of other medical conditions, even some patients that take steroids, for example, for maybe for bronchitis, for COPD, for asthma, they can also be at increased risk of developing osteoporosis too.
So when will people usually start experiencing symptoms, and what are the symptoms of osteoporosis to recognize?
So that really depends. Commonly a patient may first present with something like pain, whether it's back pain or even pain in other areas of the body, to indicate that there is something wrong. And I guess what I would want to emphasize is when a patient does feel that they should see a physician right away, so it can be addressed. A lot of times it goes unrecognized just because someone thinks it's probably nothing, and before, you want to address it before it's too late.
I never thought of osteoporosis as it relates to our backs, but you can actually have pain in your back or even small fractures as a result of osteoporosis in your back, right?
Correct. And so what happens is, the vertebrae, which are the bones, the building blocks of the back, they are weight-bearing structures. So under some type of stress, and if those bones are very weak or very brittle, they can fracture and basically essentially kind of collapse and kind of create abnormal curvature of the back, abnormal weight displacement. Certain muscles become more stretched than others, and that can lead to chronic pain.
And it can happen if you're just simply bending over to lift an object, if you miss a step, if you slip on the floor, sometimes even by sneezing if it's that far along.
Exactly. If the osteoporosis is that bad, just some basic activity that you would usually do can create this fracture.
Would you feel it? Would it be like that jar where you're like, oh, and you would actually know it happened, or is a compression fracture something you may not even really feel?
You may not even feel it right away when it happens. It's something that may be developing over time, and it may start as an aching pain and then may just continue to get worse, and basically a pain that is not getting any better with anything that you're doing, that's getting progressively worse. Those are all kind of signs that this is something serious, and you should kind of see a physician who can maybe offer some type of management early on.
Well, a lot of people think it's something, back pain's just a normal part of life. To live with it.
Exactly.
And it's never diagnosed, right?
Right. I mean, someone might think, maybe they pulled a muscle, or maybe it's a sciatica pain flare-up or something, but there are so many, structures in the back that can contribute to back pain, even aside from the spine, which is why it's important, to take these types of symptoms very seriously and to see a physician who can offer an early intervention.
At Spine Pain Diagnostics, what exactly do you do? How would the process go if someone comes to you and says, hey, I'm having these pains, they're not going going away, it's chronic, or it's starting to interfere with my daily activities?
So, we ask some very focused questions in terms of how the pain has started, what it feels like, where it is, in addition to doing a thorough physical exam. And so that really gives us a lot of information in terms of what type of pain this might be. We also order certain diagnostic tests, such as imaging tests, MRIs, X-rays will show us if there is a fracture. And we're very well experienced in knowing if this pain is related to that fracture. And if it is, there are different treatments that we can, apply.
Different procedures too. And is recovery quite quick from some of these procedures?
Yeah, one particular procedure that we do is called a kyphoplasty, and essentially we're able to insert cement into the bone of the back where that bone has fractured to basically make it more stable. And generally after that procedure, patients can feel a difference almost immediately or within a few days. And it's an outpatient procedure, so patients generally are able to go home the same day, and really not very much restriction in terms of what they're able to do, just maybe avoiding heavy lifting for a few weeks. But other than that, they can kind of get back to their daily routine.
And I know that specific one and many more are covered oftentimes by insurance. So here's how you can contact Dr. Rani Chovatiya. You can contact her at the phone number on your screen. It's 262-478-0301. That's where you can get a hold of Spine Pain Diagnostic Associates, or the website on your screen, paindiagnostics.net. They're located right in Mequon.